What is ovarian failure and its treatment? Ovarian failure, also known as premature ovarian insufficiency, POI, or premature menopause, is a condition characterized by the loss of normal ovarian function before the age of 40. This condition affects a woman's reproductive system, leading to irregular menstrual cycles, infertility, and hormonal imbalances. Understanding the causes, symptoms, and available treatments for ovarian failure is crucial for affected individuals and their healthcare providers. Causes of ovarian failure. Ovarian failure can be caused by various factors, including genetic predisposition, autoimmune disorders, chemotherapy or radiation therapy, ovarian surgery, and certain medical conditions such as Turner syndrome or Fragile X syndrome. Additionally, environmental factors, such as exposure to toxins or chemicals, may also contribute to ovarian dysfunction. Symptoms of ovarian failure. The symptoms of ovarian failure can vary from one individual to another and may include 1. Irregular or absent menstrual periods. 2. Hot flashes and night sweats. 3. Vaginal dryness and discomfort during intercourse. 4. Mood swings and irritability. 5. Fatigue and difficulty concentrating. 6. Decreased libido. 7. Infertility or difficulty conceiving. 8. Bone loss, osteoporosis, due to hormonal changes. Diagnosis of ovarian failure. Diagnosing ovarian failure typically involves a combination of medical history evaluation, physical examination, and laboratory tests. Blood tests measuring hormone levels, such as follicle-stimulating hormone, FSH, and estradiol, can help assess ovarian function. Imaging studies, such as pelvic ultrasound, may also be performed to evaluate the ovaries and rule out other potential causes of symptoms. Treatment options for ovarian failure. While there is no cure for ovarian failure, several treatment options are available to manage its symptoms and associated complications. Hormone replacement therapy, HRT involves the use of estrogen and, in some cases, progesterone to replace the hormones that the ovaries no longer produce adequately. This can help alleviate menopausal symptoms such as hot flashes, vaginal dryness, and mood swings. However, the use of HRT may carry certain risks, including an increased risk of blood clots, stroke, and breast cancer, so it should be used cautiously and under the guidance of a healthcare provider. Fertility treatments. For women who wish to conceive, fertility treatments such as in vitro fertilization, IVF, or egg donation may be options. In IVF, mature eggs are collected from the ovaries, fertilized with sperm in a laboratory setting, and then implanted into the uterus. Egg donation involves using eggs from a donor to achieve pregnancy. Bone health management. Since women with ovarian failure are at increased risk of osteoporosis due to hormonal changes, maintaining bone health is essential. This may involve calcium and vitamin D supplementation, regular weight-bearing exercise, and lifestyle modifications to reduce the risk of fractures. Psychological support. Coping with the diagnosis of ovarian failure and its associated symptoms can be challenging, both emotionally and psychologically. Therefore, seeking support from a therapist, counselor, or support group can be beneficial in managing stress, anxiety, and depression. Lifestyle modifications. Adopting a healthy lifestyle, including a balanced diet, regular exercise, stress management techniques, and adequate sleep, can help alleviate symptoms and improve overall well-being. Research and future directions. Advances in medical research continue to enhance our understanding of ovarian failure and its underlying mechanisms. Ongoing studies focus on identifying new treatment approaches, such as ovarian tissue transplantation and stem cell therapy, as well as exploring the potential role of regenerative medicine in restoring ovarian function. Furthermore, efforts to raise awareness about ovarian failure and improve access to healthcare services for affected individuals are essential in promoting early diagnosis and intervention.